I'm Dr. Hesselberg from Hesselberg Chiropractic. I'm just going to show you my daughter getting adjusted here. This is Natalie. Natalie is 6 years old in kindergarten, and so we're going to take you through an adjustment, how a kid gets adjusted. There's a couple different ways kids get adjusted. There's tools that you can use, and this is how we started her off. When she was, as soon as she was born, we adjusted her about 15 minutes after birth. Which is probably one of the most important adjustments always to give a kid when they're first born. As they come out of mom, the doctor's usually pulling on the head and pulls and causes a subluxation at that time, which is the bone out, putting pressure on a nerve and causing nerve interference, and that nerve interference causes kids to have allergies and a lot of different other sicknesses and problems. So this is one tool that we use. As you can see here, I'll set it on a very gentle setting. When we adjust it, we move it, moves my finger very little. If you can go up to bigger settings on it, we'll set it about halfway. You can see it moves it much more, but that actually is a very gentle adjustment that puts the bone back in alignment before the muscles can contract. The other way a kid can be adjusted is just a regular adjustment, so we're going to show that here. So first off, she's always got her atlas, which is this top bone in her neck, out of place. Then it's always off to the left side, or not always, but when we actually find it, it's off. So that could cause her to have some sinuses, allergies, headaches, or anything like that. So we come in and put just a little pressure right there, and then it popped into place, and we can hear that. Did that hurt? No. So then we come in, we're going to check her arms to see if that's back into alignment, and it is. So what I'm going to do now is I'm going to sit her up. I'm going to scoot her forward a little bit, and then we're going to, and she already knows the drill, how to cross the arms and get ready for that. So now we're going to check into her mid-thoracic area, or her mid-back area. These are the nerves that go back into the heart and lungs, so we want to open them up and get her breathing better and get the oxygen through and keep her healthier that way. So I just put a little pressure right back here. We're going to lay her right on top of my hand, which is very gentle. And move is there. We're going to come down just a little bit more. And it moved there. And I'm going to lay you face down. And she'll turn face down now. And so now we're going to just palpate the spine. We're going to come down and feel if we got everything back into alignment there. And we do, and then we come down and we'll check the hip. Now she's got her left hip off. So if you can kind of look at it, you can see with her legs here, this one's a little bit shorter. That means this hip is up a little bit higher and this hip is dropped. So her hip is turned like this. So we're going to put that into place. So I'm going to have you face me on your side. And so we'll bend this one here. And bring her up like this. And so what we're going to do is bring this hip into this position here. And it pops there. We're going to bring it to this other side. And so we'll keep this bottom one straight, bend this one here, and put her on her back slightly right there. And then bring this one towards me. And lay you face down. And then we come back into looking at her feet there, and you can see they come back to the level. And then we check, and you can feel the hip is back in. Check the rest of her spine. And that is a kid getting adjusted. She's been adjusted many times, so she's kind of a little used to it. We start them off, kids, mostly with tools like activators because they're not used to all this. But as they get more used to what we're adjusting and understand what we're doing, you can see that that did not hurt a 6-year-old, so it's not going to hurt an adult if we did it. It doesn't hurt anybody. It actually feels good, and it gets the body and the nervous system working correctly and keeps the body healthy. Thank you.